Hello, Mahanur. I think we should start. I should wait for other participants.
I think we should start because मेरे speaker को 7:15 का time दिया है, so we should start.
I think we have to start. Yes. Okay. Assalamu alaikum. Good evening to everybody. This is Abdul Ghani, President of PUMS LC, and I have the pleasure of hosting today's important and impactful session. I would like to extend a warm welcome to all of you, our esteemed guest speaker, organizers, the coordinators, and each and every participant who has taken the time out of your busy schedules to be with us. Your presence truly means a lot for us. Today, we are here to talk about some things that deeply affect the health and well being of families around the world, the complication of pregnancy. As we all know, the pregnancy is a beautiful and life changing journey, but it can also come with unexpected challenges. Complications during pregnancy can affect both the mother and the baby, sometimes leading to serious health risks if not identified and managed in time. Sadly, Many of these issues go unnoticed due to lack of awareness, limited access to care, or delayed medical attention. That's why this session is so important. Our goal is to raise awareness, share knowledge, and empower our community to recognize the signs early and take actions to ensure safe and healthy pregnancies. Together, let's work towards a future where every mother receives the care she needs and every child enters the world healthy and strong. And that brings us to our slogan, that is, healthy mother with an healthy baby. So, without any further delay, I would like to invite one of our energetic and talented team member, Halima, to lead us into the session with a quick and fun icebreaker. Over to you, Halima.
Thank you, Abdul Ghani. Assalamu alaikum, everybody. Can you hear me?
Yes, we can hear you.
Okay, Assalamu alaikum, everybody. My name is Halima Sadia. I am the local officer of SCOP here at the KIMS LC, and I'm responsible for the icebreaker session today. So for the icebreaker session, I'll be asking any of you one thing, and the question is that if either of you were given a wish that could come true, if there was a genie that could have any of your wishes come true, be it the most impossible to the most realistic wishes, what would it be? So let me have a look at the participants. Mahnur, should we begin with you?
Yes, sure.
So Mahnur, if you were given a wish, be it the most unrealistic or the most realistic, what would that wish be?
I wish to have a superpower of being invisible so that I can like avoid such circumstances. Like,
Oh, that is really interesting.
and I want to fly. Like, like I want that. Like Doraemon, I have a magical door. I can go wherever I want.
Yeah, those two will be very useful for sure.
And the third one also, I want कि मेरा जो mind है मैं मैं जो चीज देखूं वो मुझे याद हो जाए. So it will be very useful in passing MBBS with good marks, you know.
Yes, for sure. And Abdul Ghani, what about you?
Actually, I didn't listen your questions clearly because there is, Azan is praying. That's why you have to repeat your question.
Oh, yeah, no worries. So the question is that if there was a genie granting any one of your wishes to be true, तो ऐसी क्या wish होती जो आप चाहते कि वो reality में बदल जाए और क्यों?
I just want to go directly to the America to the future or the goal that I'm pursuing. Without any hardship, go and directly do pursue the medicine over here. Don't do that much hard work.
Oh, okay. So without going through the match process and applying for the match.
Yeah. So I know to make that all things as a piece of cake.
That is a good wish. So thirdly, we will end with Alishba Iman.
Yes, अगर मेरे पास सुपर पावर होती so it would be to read people's mind.
Really? And why is that?
To get to know then what they are thinking.
Don't you think that's a bit of an advantage because not everybody has a positive opinion on everything?
Yes, but I know that they are not like having a positive opinion regarding myself. So मुझे पता चल जाएगा who is sincere with me and who is not. मेरी efforts
Yeah,
आया नहीं
that's
होती.
true. Less effort. That's it with the icebreaker session, everybody. Thank you.
Okay, thank you, Halima. That was wonderful from Halima's side. Now it's my pleasure to introduce our esteemed speaker for today's session, the Professor Saima Rafiq. Dear participants, she is the head of the Ghani department and chair of the faculty development program. She has also served at the University College of Medicine and the University of Lahore. We are honored to have you with us today. Over to you, ma'am.
I think अभी मगरिब की अजान हो गई है तो you guys can go and offer your prayers.
Do we have the speaker right now?
No, अभी मगरिब की अजान हो गई है तो I think you should go and offer your prayers. Then inshallah we will start at 7:20.
It's 7:20. Okay, that's fine. That's fine. We can.
Assalamu alaikum. Okay, so let's start.
Ma'am, actually, participants are gone for their prayers.
Okay, sorry.
This we can wait for what, 2 to 3
Okay,
minutes.
we can have this little bit of introduction of everyone. Meanwhile, the other ones can join.
Sure, ma'am. Starting from me, I am Mahmood Khan, National Officer for Reproductive Health, MSA-Pakistan. I am currently studying in final year MBBS at Medical College.
Okay, good one. So you can share your name, year, and the medical name of the medical college where you're studying, or maybe one of your strength or one of your expertise area of expertise. What do you think is your strength or the biggest achievement? So, okay, next. जी अलीमा आप बताएं.
Assalamualaikum. I am Halima Sadia. I'm a fourth year medical student at CMH Karachi.
Okay, very nice.
One of my strengths would actually be, I think it's communication. I think I have that skill of being able to communicate with all age groups on any topic. So I think that's my strength.
Okay, very nice. Okay, जी, Dr. Sami, Dr. Wasim. You can introduce yourself if you want to. Misbah, Aliza.
Assalamu alaikum. I'm Sami Baloch and I'm a fourth year medical student at Bolan Medical College, Quetta. And I'm also working as VPI LC Bumps. And I'm not yet sure about my strengths.
You must be sure about your strength. बस मुझे समझ नहीं आई कि ये CPI क्या है.
VPI is basically Vice President Internal Affairs. आप अपने LC के अंदर जितने भी एक्टिविटीज वगैरह होते हैं जो भी हो रहा होता है अपने से बाकी जो मेंबर्स होते हैं आप उनकी चीजों को हैंडल करते हो उनको देखते हो उनको गाइड करते हो.
Okay. So don't you think you have some leadership qualities?
Yes, I have leadership qualities वो भी अच्छे.
अच्छे leader वाली qualities हैं. Good. He, Dr. Wasim, Misbah, Fiza, Dawood, anyone?
Assalamu alaikum. Can you hear me?
जी जी Fiza.
I'm Fiza Osman. I'm a first year student from CMH Kharia Medical College, and I'm part of the local council of the MSA. And one of my strengths would be that I am usually the first person to take the initiative in
Very
anything
nice.
that.
Very
Okay, that will be all. Thank you.
Okay, and if you know that this is your strength, I guess you will excel further in your life, inshallah. जी
Okay, thank you very much. Inshallah.
inshallah. Guys that know each other, Aisha, Athiya. So I'm actually having an idea.
I actually have a question for you as well.
Yes.
Now, what would you say is your strength?
I feel okay. I feel I have many strengths. No. The biggest thing I feel is that I never give up. I never give up. I feel that is my strength. That I work hard and I never give up. And I don't let the very you can say the little thing to bother my mind. Oh, Athiya, very nice. Okay, so if you are even using the chat box, that is a good sign. मैं दीवारों से बातें नहीं कर रही. Unstoppable. Very nice. It's difficult, but I think that your hard work at least pays off. But you need stamina for that, not to give up. So anyone have any idea to go in gynae? So let's twist the question.
Yes, ma'am. I have interest in this field. Like one of the reason of joining MBBS was like I was interested in gynae.
Oh, very nice. Actually, we need some dedicated person because at the end of the day, there are many people who are ending up in gynae ops ward, but not with the patient. So that's not actually a good thing. We need someone really passionate. Gynae has so much to offer you. We can have it some place in your schedule or so. We can even discuss what are the options if you are a gynecologist, what would be your career opportunities in this setups. It's not just that you can be a, if you want to, maybe you have heard कि जी delivery करा रहे, so that thing is called obstetrics. Again, gynae is basically related to the problems of the females. So you may have chance of having ending up as an infertility consultant who may go for minimal invasive surgeries or urogynecology. So there are many fields or avenue for persons who follow in
I
So,
think in Pakistan there is very less scope of IVF.
let's scope of.
IVF, in vitro fertilization. Like there are very less
No, 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 no,
IVF.
no, no, madam, no, no, please. The scope is not okay. You are saying IVF. मुझे आपकी आवाज थोड़ी कट के आ रही है. ये नहीं है. There are many infertility centers and they are doing a great job. But मसला ये है कि जैसे वो पाकिस्तानी वो करते हैं ना कि एक के बाद एक चीज करते हैं और फिर बस उसके पीछे पड़ जाते हैं. So now we have very, you can say कि the infertility clinic in every other um, city and all that. So, but even then, these centers are doing good job. Even in internationally, the success rate of in vitro fertilization is 25 to 30%. So if you are doing good cases, only 25 to 30% will have baby, or even the take home baby rate is little less because at times the pregnancy occurs, but it may end up in miscarriages. That can be the thing. Okay. Okay, जो कोई नया ज्वाइन किया है, would you like to introduce yourself? क्या आपकी strength है? एक मनाहिल, अब्दुल गनी, लाइका, नूरुल इमान, very nice name. बाइक, ये तो इससे ही है आपके. So this is what is the name of your federation basically? Medical student?
Medical Student Association Pakistan.
Okay. So what are your goals and objectives, and how you people do your daily activities or so? क्या करते हैं? कैसे बॉडी है?
In MSAP.
कैसे इलेक्टेड बॉडी है, ये वॉलंटियर किया हुआ है, कैसे बॉडी बनाई है?
Ma'am, actually, there is an international organization named IMSA. So,
Okay.
2 years before, we were associated with that body.
Okay.
So, we are actually a part of that. And we have six standing committees in MSAP. And each of them deals with like a specific branch. Like we have Community Standing Committee for Medical Education, Court for Rights and we have Standing Committee for FORA, and then we have Standing Committee for Professional Exchange and for Research Exchange and
Okay.
for Public Health. Like it deals with different diseases and vaccines. Actually, we do awareness campaigns under SCOM. Like it's a standing committee for public health. So this way we try कि हम अपनी सोसाइटी में अपना पार्ट प्ले कर सकें. एक माइनर लेवल पे ही सही, but
नहीं, it's very nice to have a very diverse group. See, there's Ami sitting in Quetta, Halima sitting in Karachi. So you have a very, and Fiza in Kharia. So you have a very sort of diverse group in missions. So it's like, I will really for collaborations of Misal. That would
ma'am,
be
I think we can start now. Like,
okay.
If you are not in hurry, we can
Ma'am,
start.
I want to ask question. Please. I was having a prayer.
Okay. It's okay.
As you had asked about the introduction and the weaknesses and strong. Okay. So
Yes.
myself, Abdul Ghani, President of Bolan University of Medical and Health Sciences at Quetta, and host for today's session. And my, strength is somewhat similar to you. Never give up, and having a
Yes,
patience
nice.
and know when you loses and how to get up. And secondly, I'm having a question for you: that what are your weaknesses and how you cope with them?
I
I
think
want to
my
know from your side.
weakness, I think my you cannot. This is the I discovered over the time that this is my weakness. I am very straightforward person. So you see, in this world, at times you cannot survive with so much straightforwardness. So I don't want to be diplomatic, but sometime I wish that I should have learned a bit of diplomacy.
So, what are the tactics that you utilize to cope with this weakness that you utilize?
I don't feel it as a weakness, but personally I don't feel that this is my weakness. But the people do realize me that this is your
No,
weakness.
I want to know those weaknesses that you realized these are my weaknesses.
I think maybe short temperedness that you can learn your anger management, and that happens at times with my profession, especially my specialty or so. So I have a bit of short temper, but now I have learned over the years to manage that with stress management and anger management workshop.
Okay, thank you,
Hopefully,
ma'am. Thank you, ma'am. Thank you so much. Thank you so much.
so even you can learn this anger management. You learn the management of your anger issues. Okay, so should we start?
Yes, ma'am, you
Yes,
can
ma'am,
start.
we have to start.
Okay, so what are you expecting from this session or lecture or webinar? I don't know what it would be at the end. We will name it at the end. ये क्या था? Lecture, ये interaction or something. What are your expectations? क्या discuss करेंगे?
मैम जो मेजर कॉजेस हैं कॉम्प्लिकेशन ऑफ प्रेगनेंसी के, लाइक हाइपरटेंशन है या जो भी इस तरह से जो पाकिस्तान में लीडिंग कॉजेस हैं कॉम्प्लिकेशंस की, और उसको हम किस तरह से प्रिवेंट कर सकते हैं.
Okay, so it's a big topic actually. So that's why I'm asking you, okay, what is your what is the thing in your mind? Because the pregnancy-induced hypertension itself is a big topic, and I guess we can do a follow-up session. And today, let's stick to this pregnancy-induced hypertension. But you have heard about pregnancy-induced hypertension? Anyone of you? Any idea what complication can occur with pregnancy-induced hypertension?
Eclampsia, preeclampsia.
Eclampsia, preeclampsia. Okay, so what are they? Definitely, I will convince a few of you for gynae and obs. Definitely, Halima, I will definitely convince you for gynae and obs. Okay, so yeah, you have ever heard of the word eclampsia? अच्छा, कभी ड्रामो फिल्मों में देखा है वो कैसे बता रहे होते हैं कि प्रेगनेंसी कैसे कंफर्म होगी? कोई सीन कैन एनी मूवी सीन और सो इन योर मेमोरी देखा है ना कभी ड्रामा या उसमें बता रहे होते हैं जी ये
Yes, ma'am, dizziness, vomiting.
वॉमिटिंग से. ओके, और अगर कोई बहुत पुरानी मूवीज देखे ना तो उसमें सिर्फ वो दिखा रहे होते हैं कि द डॉक्टर केम, दे जस्ट चेक द ब्लड प्रेशर एंड से और द पल्स एंड सेड दैट द पेशेंट इज एक्सपेक्टिंग. So let's start with something that is called the physiological changes of pregnancy. The one who are in first year or so, they have an idea that there are certain changes that occur in pregnancy during in the blood in every system of the body. So what happens in for the cardiovascular system, that the heart rate of mother will increase roughly 10 to 15%, and there will be a fall in peripheral vascular resistance. So, what would be the normal effect of pregnancy on blood pressure? And yeah, so let's have a brainstorming. How the what do you know? But the blood pressure is the product of heart rate. The one who are doing first year, blood pressure is product of
Heart rate and cardiac output.
heart rate and cardiac output. Very nice. Okay, so when there would be the fall in peripheral resistance, what will be the effect on cardiac output?
Definitely, there will be tachycardia. I think reflexive tachycardia.
The blood pressure will increase or decrease? It will
that will be
decrease.
going to manage,
The blood pressure
as
will be
there is fall in resistance of the peripheral vascular resistance. So
Mhm.
definitely there will be reflexive tachycardia.
And what is the cardiac output is product of
Cardiac output is,
heart rate
I
and
think that is stroke volume
stroke volume and
into, I
heart
think,
rate
heart
and heart
rate.
rate,
Yeah,
heart rate
yeah.
and stroke volume. So what happens in a normal pregnancy? The heart rate will increase, but because of a fall in peripheral resistance, and there will be decrease in diastolic blood pressure. सो द रीजन कि वो एक मूवीज में एक बंदा आता है, प्लस पल्स चेक करता है, ब्लड प्रेशर चेक करता है और कह देता है कि द पेशेंट इज प्रेग्नेंट. दिस इज बेसिकली ड्यूरिंग द अर्ली प्रेगनेंसी देयर इज अ फॉल इन डायस्टोलिक blood pressure. Maybe you may found a diastolic drop of up to 40 or even 30 mm of mercury. So that's why this is actually, you can say, the physiological changes of pregnancy. So for a patient who is pregnant, we are not actually bothered by a low blood pressure. We are always bothered by high blood pressure. So let's see what happens in a normal pregnancy, why the blood pressure will be increased. Okay. So there are certain definitions, and you can say that this is a term that we usually use in gynecologist is that pregnancy induced hypertension, or you may have heard PIH. सुना हुआ है PIH का नाम? तो आप उसको डिफाइन कैसे कर रहे हैं? ब्लड प्रेशर ऑफ 140 over 90 millimeter of mercury or more after 20 weeks of gestation. Why this cutoff of 20 weeks of gestation? Any idea? If the patient is have the blood pressure before 20 weeks of gestation, then it would be called existing hypertension. So this patient must have an hypertension but before the pregnancy. It's not related to pregnancy. Or उसकी pregnancy that is called that pre-existing patient is entering in pregnancy with a pre-existing hypertension. Okay, but the full definition will have you can say that the blood pressure of 140 over 90 millimeter of mercury, two readings 4 to 6 hours apart after 20 weeks of gestation. You cannot label the patient on a single reading. It will affect about 5 to 10% of pregnancies globally. Almost the same incidence is in Pakistan. We don't have any higher incidence of pregnancy-induced hypertension, but we have a higher incidence of eclampsia or preeclampsia because the patient do not follow the antenatal clinics, and at times they are not diagnosed. And when they diagnose the patient, they are already in preeclampsia or eclampsia. You should be very clear that the antenatal care or providing antenatal care will not prevent the cases of PIH. Actually, the idea of providing the care throughout the pregnancy is just to prevent the cases of preeclampsia or eclampsia. Okay? Okay. So it would be a leading cause of maternal death and perinatal morbidity and mortality. You have an idea what is perinatal? The death of baby 7 days postpartum, or the death of baby inside the utero, which is called the intrauterine demise of fetus. जब हम देखते हैं maternal mortality की causes, we say that maternal mortality is death of a mother while pregnant or within 42 days of pregnancy. Why the causes that are already not related to or aggravated by pregnancy? So in Western world, the top one cause is pregnancy-induced hypertension or its complication. For Pakistan, the number one cause is hemorrhage. But at number two, there may be sepsis or this pregnancy-induced hypertension or the complications of pregnancy-induced hypertension in terms of preeclampsia or eclampsia. Okay, hopefully so far so good. So this is actually, you can say, the spectrum of disease in terms, or maybe let me read your chat if there is any important. Vomiting, yes. Vomiting is, you say, we say that if a patient comes to you with vomiting in pregnancy, always exclude hypertension in pregnancy until proved otherwise. DMI sign, yes. Okay, so when you say that this is a spectrum of disease, so as number one stage, gestational hypertension, or you can say the pregnancy-induced hypertension, when the patient will have only raised blood pressure. Then the second, you can say in the spectrum is preeclampsia. Preeclampsia would be combination of, देखा हुआ है, let's discuss. So preeclampsia is combination of proteinuria, hypertension and proteinuria, and eclampsia will be when there are fit. ठीक है, सो ये तीन आपकी मेन जो हैं वो बड़ी कैटेगरीज हैं डिपेंडिंग अपॉन द severity that you have a range of gestational or pregnancy induced hypertension, then preeclampsia, then eclampsia. And the chronic hypertension would be that the patient was hypertensive before 20 weeks of pregnancy. So that would be a separate entity. Okay, even these chronic hypertensive patients will have superimposed preeclampsia during pregnancy. So it's very important even to, you can say, diagnose these cases. So, okay, so इसमें जो सबसे important बात है pregnancy induced hypertension की, उसमें समझने की, that is its etiology is, you can say, multifactorial. But this disease is typically seen in primi gravida. So what is the meaning of primi gravida?
Who have conceived for the first time?
Yes, the female who has conceived for the first time or who is having a first pregnancy. So you have to understand that when the baby is formed inside the mother, it's just like a foreign body. So in some patients, actually, this the baby inside the uterus and the formation of placenta inside the uterus, it induces a response. And this response results in pregnancy-induced hypertension. So if you say that what are the, you can say, risk factors for preeclampsia. So first, pregnancy is always risk of preeclampsia or eclampsia. If patient gives you history of previous PIH or eclampsia, there are chances that this patient will have recurrence. Think of some condition that can also cause pregnancy-induced hypertension. Let's say think of something. So multiple pregnancy, when there will be two babies, a big placenta, the cause of pregnancy-induced hypertension is in placenta. You have to remember this. If you cannot control the case of eclampsia if you do not deliver the baby. So it's basically the delivery of placenta that will then, you can say, revert the whole changes of pregnancy. So it's an abnormal presentation. मैं वो आपको अगली पिक्चर में दिखाती हूँ कि क्या abnormality है presentation की. Then a vascular imbalance with release of these are called the thromboxane A2 would be prostaglandins, inflammation and oxidative stress, and then there will be poor perfusion to baby. That will result in reduced uteroplacental blood flow, and the fetus will have reduced growth. Clear? Okay. So you can see this is how a normal placenta is formed. You can say this would be the amniotic cavity. This is an umbilical cord, and then there would be the formation of villus. If you recall your knowledge, or our colleagues from first year maybe help us, that when the chorionic villi are formed, they will have a blood vessel inside this villus, and then there would be trophoblastic cells. So trophoblastic cells का नाम याद है? कौन से ट्रोफोब्लास्ट होते हैं? Syncytio and cytotrophoblast. Okay. So what happens? Can you appreciate these red one? ये क्या है? ये बेबी की साइड है ना, जो amniotic cavity है, और ये मदर की साइड है. What are these red ones? इन्हें क्या कहते हैं? क्या बना हुआ है? Spring बना हुआ है ना? So these are the spiral arterioles that are basically supplying the endometrium or and then myometrium of the uterus. Okay, yes, spiral arterioles. Very nice. Thank you. Okay. So what happens in normal pregnancy? That these cytotophoblasts, they invade these spiral arterioles. First, the portion that is inside the endometrium, um, and then the portion which is in the myometrium. So what, as a result of these invasion, what happens? Okay, instead of these spiral arterioles, this vessel, as you can see, the diameter of these vessels, they basically cytotophoblasts, they engulf the tunica media of blood vessels. What is in the tunica media of blood vessel? Tunica media में क्या चीज है? याद है ना, blood vessel का एक endothelium होती है, then tunica media, and then adventitia. Okay, so what is the content of tunica media? Muscle. Thank you. So when they engulf the muscle, so there would be no vasoconstriction. Vasoconstriction is narrowing of blood vessels. So these cytotophoblasts and sensitotophoblasts, they have actually engulfed the tunica media of spiral arterioles. Now the spiral arterioles cannot contract. They will be open like a delta. फायदा इसका क्या हो रहा है? बॉडी में जहां कुछ जो भी हो मदर के साथ, बेबी को ये इतने बड़े डेल्टा चैनल से ब्लड जाता है. Clear? So, but in in the first phase, the cytotrophoblast will engulf the tunica media of spiral arterioles in the basal layer of endometrium. And then comes a second wave of trophoblastic invasion when they will engulf the tunica media of myometrium. So the patient who develop pregnancy-induced hypertension, they have this lack of second wave of trophoblastic invasion. So you can see in comparison, this artery is, this circulation is narrow. ये जो fetus उसकी तरफ जा रही है, विलाय, वो ये narrow है, and this is a wide normal situation. This is the situation with the patients of preeclampsia. So baby को blood flow कम जाएगा. This is called uteroplacental insufficiency. That the placenta is not receiving a normal amount of blood from uterus. This is called the uteroplacental insufficiency. And this uteroplacental insufficiency will result in growth retardation of fetus. Fetus will not achieve the ideal growth potential. So far, so good. Or any questions? So when you may find a question in your exam that what is the abnormality in patients of pregnancy-induced hypertension? So it is the absence of second wave of trophoblastic invasion. Sahi? Okay. So this is again the same thing. See, this is the normal circulation. This is normal pregnancy. You have such a dilated blood vessel within the decidua. Decidua is actually the word for pregnant endometrium. So endometrium का part देखें कितना dilate हुआ है, इसके बाद myometrium के भी one part में यहाँ तक dilatation है. So this is something normal, the second wave of trophoblastic invasion. Or in comparison, you can appreciate in this picture that the myometrial portion of trophoblastic invasion is absent. So that is actually responsible for high blood pressure in pregnancy-induced hypertension. Okay. So just have a look on this. Or to मैं आप लोगों से पूछते हैं. Aman, do you want to have any comment or question? Okay. So क्या क्या चीजें हैं? So let's read it together. सबसे ऊपर क्या आया? Proliferation, invasion, angiogenesis, immune tolerance. So these are the underlying mechanism. But what they have done is insufficient or abnormal placentation, leading to reduced placental perfusion. So maternal factor would be released. जिसमें anti-angiogenic factors हैं, pro-inflammatory factors हैं, और auto-antibodies हैं. What they will do, they will do a systemic endothelial dysfunction. पूरी बॉडी में सारी जगह पे एंडोथीलियम का डिसफंक्शन. So as a result of that dysfunction, what will happen that in kidneys, this endothelial dysfunction has a unique name that is called glomerular endotheliosis. अगर आपको याद हो या जिन्होंने अभी पढ़ना है फाइनल ईयर फोर्थ ईयर वालों को याद होगा, there are the podocyte in glomerular apparatus. So what happens that because of this vascular damage and endotheliosis, there is a gap between these podocytes. And as a result of that gap, the protein molecules can leak and they can come in glomerular infiltrates. So that's why these patients will have proteinuria. Okay, protein कौन सी आएगी यूरिन में? सबसे छोटा मॉलिक्यूल किस प्रोटीन का है?
Albumin.
Albumin. ठीक है? So albumin is a small molecule as compared to globulin. So these patients will have albumin. Okay. And as a result of this systemic vascular damage, these patients will have hypertension because there is a constant state of vasospasm in these patients. वो जो उन normal patients में एंडोथीलियम का ट्यूनिका मीडिया जाएगा तो उनको वेसोकंस्ट्रिक्शन नहीं होती. लेकिन इन पेशेंट्स में हमने कहा कि इनकी सेकेंड वेव ऑफ ट्रोफोब्लास्टिक इन्वेशन नहीं है. सो दीज पेशेंट विल हैव हाइपरटेंशन एंड देन दे विल हैव कोएगुलेशन एबनॉर्मलिटीज रिजल्टिंग इन हेल्प. तो एनी आइडिया हेल्प क्या है? Help is actually a complication of preeclampsia. The patient who have hypertension and proteinuria. They, with severe state, what happens? They have a subcapsular hematoma of the or edema of the liver. So their liver function test will be deranged. So this help stands for hemolysis, elevated liver enzymes, EL, and the next LP is for low platelet. So this is you can say that how this name help was given to this condition. And then there will be if the vessels are leaky inside the. So you see these as a result of this damage of you can say endothelial dysfunction, all the vessels are leaky. So if they are there will be edema, leakage of fluid inside the brain, they will cause cerebral edema. If there is the leakage of fluid in optic disc, you can say the swelling of disc, these patients will have blurring of vision. Even in some very serious cases, these patients may have blindness. If there is optic disc edema, these patients may present with blindness. And in kidneys, they will result as proteinuria. Lung में क्या होगा? Lung में fluid leak हो तो क्या कहते हैं? Lungs का lungs में क्या है? Yes, pulmonary edema. So pulmonary edema को कैसे पिक करते हैं clinically? Patient will present with dyspnea, and when you auscultate, shortness of breath, yes. And when you auscultate,
nocturnal cough.
Nocturnal cough हो सकती है, okay. और auscultation पे क्या मिलेगा?
Exertional dyspnea हो सकते हैं.
ओके, एक्सर्शनल से ज्यादा जब फ्लूइड है तो ये तो आपका उस दोनों में होगा डिस्निया. इट्स नॉट एक्सर्शनल जस्ट. ऑस्कल्टेशन पे क्या मिलेगा? The lung basis will have crepitation, fine inspiratory crackle on the lung basis. And what would be the treatment of pulmonary edema? क्या करेंगे?
think loop diuretics दे सकते हैं.
Loop diuretics with the name of furosemide.
furosemide.
furosemide, ठीक है, हमारे
Yeah.
जो ब्रांड उसमें आ रहा था नेम, that would be Lasix, injection Lasix, the commonest name. But yes, the salt is furosemide. So when you give the furosemide, it's a loop diuretic. The patient will have that fluid in the glomerular filtrate. It will pass the urine, and the patient will have stabilization. और पेशेंट का वो रिश्तेदार आपका बड़ा हाथ चूमेंगे कि बड़ा डॉक्टर साहब ने फटाफट एक अच्छा इलाज कर दिया. Okay, so this is again the repetition, just a colored version, so that you may have better retention. So normal placental development, inadequate because of inadequate trophoblastic invasion, there will be placental ischemia, there will be release of angiogenic factors and vasoconstriction and hypertension. ठीक है, इन पेशेंट्स को हाइपरटेंशन के जब हम प्रेगनेंसी इंड्यूस्ड हाइपरटेंशन के ट्रीटमेंट में ड्यूरिंग प्रेगनेंसी हम कभी भी डायूरेटिक्स नहीं देते. रीजन, इनका जो इंट्रावेस्कुलर वॉल्यूम है इट्स ऑलरेडी कॉन्ट्रैक्टेड. It's because of leaky channel that the patient is having or because of these angiogenic factors that the patient is having hypertension. So इनको आपने Lasix प्रेगनेंसी में हम Lasix नहीं देते, डायूरेटिक कोई भी नहीं देंगे. Okay, so this is a picture in your 10 teacher. I guess you may have a very nice picture of a female with effect of hypertension on every organ. तो ये हमने पहले ऑलरेडी देखा है कि हर जगह पे इफेक्ट होने से क्या क्या होता है. तो लंग्स में पल्मोनरी एडीमा, methyl dopa is the drug for using hypertension, blood pressure. This is drug. I don't know what you want to ask about methyl dopa. You give methyl dopa. Methyl dopa is not a diuretic. Methyl dopa is alpha 2 वो है blocker. They act as an agonist और इसकी only indication methyl dopa की in pregnancy है. इसके अलावा तो आप इसको कहीं भी नहीं दे रहे. Yes, for gestational hypertension. During pregnancy, that there is baby, and the safest drug and the drug which we are using for the pregnancy is methyl dopa, alpha methyl dopa, alpha 2 agonist. Okay, so in the lungs, you will have pulmonary edema, then you may have even brain cerebral edema. Kidneys का भी हमने कर लिया था पहले. There are some people that they may develop this diabetes as a part of preeclampsia. There are a few cases. Then on eye, the optic disc edema. And baby पे क्या effect होगा? There will be intrauterine growth restriction. अगर आप उस पर भी नई पेशेंट को पिक करते, then even the baby may have intrauterine death of fetus because of uncontrolled hypertension. Okay, so this is actually you can say कि आपको क्या क्या investigations करानी चाहिए patient. Correct sizes ले लिखा है cuff का, और cuff आपको ideally पता होगा. You will apply a cuff on the at least 2 finger above the cubital fossa. You will palpate for brachial artery, and then you will have blood pressure with palpatory method, और उसके बाद आप इसमें आहिस्ता आहिस्ता उसको स्फिगोमैनोमीटर के साथ दोबारा देखें, और यू हैव टू यूज द क्रोटोकोफ 4 and 5th sound. 4 और 5th sounds क्या क्या है क्रोटोकोफ? एनी आइडिया? ब्लड प्रेशर कैसे बताते हैं? पहले साउंड आएगी, फिर फर्स्ट ईयर सेकेंड ईयर वालों का मुझसे अच्छा आता होगा क्रोटोकोफ साइंस. We in pregnancy use the 5th sound. Basically, when there is disappearance of sound, you will take the diastolic blood pressure on that point. And then you will measure the proteinuria. You can simply do with the protein dipstick test. That is, stick comes and उसके साथ आप proteinuria check कर सकते हैं, और even lab में भी भेज सकते हैं, वो भी proteinuria check करते हैं. और क्या आपको टेस्ट कराने पेशेंट के जो प्रेगनेंसी इंड्यूस्ड हाइपरटेंशन के साथ आया है? You will have a blood complete examination with platelet count. Then blood sugar random, urine complete examination for proteinuria, and then clotting profile. Clotting profile में क्या क्या चीज है? ना ना नाम कभी clotting profile का yes आ रहा है कोई आंसर? Let me check. Okay, prothrombin. Yes, prothrombin time, activated partial thromboelastinin time, and PTA, PTT, and serum fibrinogen. So आप ये तीन चीजें कराएंगे, ठीक है, क्लॉटिंग प्रोफाइल में. ओके, अब हमने कहा रीनल फंक्शन पे भी अफेक्ट होता है, सो यू विल गो फॉर रीनल फंक्शन टेस्ट, यू विल हैव लिवर फंक्शन टेस्ट. जब ये आपने बताएंगे ना कि हेल्थ तो नहीं है, ठीक, तो दिस इज कॉल्ड अ PIH प्रोफाइल. हम जब जैसे गाइनो ऑप्स में कह रहे होते हैं, यू विल से दैट इस पेशेंट की PIH प्रोफाइल भेजें, तो इट्स अंडरस्टूड कि इसमें ब्लड कंप्लीट एग्जामिनेशन जाएगा विद प्लेटलेट काउंट, then you will have urine complete examination for proteins, blood sugar random, clotting profile, LFTs and RFTs, liver function test and renal function test. Or if your patient is producing proteinuria and the protein are positive in urine, you have to quantify the proteins for 24 hours urine sample. That is called 24 hours proteinuria. तो यू आस्क द पेशेंट कि आज जैसे आपने कलेक्शन शुरू किया तो मॉर्निंग का यूरिन डिस्कार्ड कर दे, उसके बाद जो भी यूरिन होगा तो पेशेंट कलेक्ट करेगी एक जार में, ठीक है. और नेक्स्ट मॉर्निंग का यूरिन जो उसमें डालेंगे, देन यू विल मेजर द कितना यूरिन है, 1 लीटर 1.5 लीटर और सो, एंड देन इट इज बीइंग सबमिटेड टू द लैब, और फिर वो निकाल के देते हैं कि 24 आवर्स के यूरिन में कितने प्रोटीन्स हैं. So normally in pregnancy you can have 3 up till 300 milligrams proteins in 24 hours of urine. The reason is that in normal pregnancy the glomerular filtration rate is increased because of increased blood flow to the kidneys. तो बहुत ज्यादा फिल्ट्रेट बन रहा है. जब ज्यादा फिल्ट्रेट बन रहा है तो उसमें चांसेस हैं कि कहीं प्रोटीन्स भी आ सकती हैं, ठीक है. सो अप टिल 300 मिलीग्राम पर डेसीलीटर प्रोटीन यूरिया से ज्यादा होगा तो दैट इज सिग्निफिकेंट. ओके, तो मैनेजमेंट ऑप्शंस क्या हैं? Management will depend upon how the patient is presenting. Number 2, proteinuria. How you are actually, जो आपको स्पेक्ट्रम दिखाया था ना, how you are actually making a diagnosis that this is simply pregnancy induced hypertension or this is preeclampsia. और preeclampsia है तो फिर आपको बहुत vigilant रहना है because the patient can even proceed to eclampsia. So gestational hypertension है, you can admit the patient if the patient can as a day case and get the blood pressure record. And then you can, the first line of drug is basically alpha methyl dopa. The dose is that you can give 2 grams per day, not more than 2 grams. So if you give a patient 500 mg QID, then it would be the maximum dose. So it has to give an TDS देनी पड़ती है 3 times a day. You can start with 250 mg 3 times a day and your maximum dose is 500 mg 3 or QID 4 times a day. इससे ज्यादा नहीं कर सकते. अगर आपको और ऐड करना है तो सेकंड लाइन ऑफ ड्रग्स कैन बी कैल्शियम चैनल ब्लॉकर. किस नाम से आते हैं? क्या क्या है सॉल्ट्स कैल्शियम चैनल ब्लॉकर के? लॉडिपीन आता है ना, नेफेडिपिन के नाम से ही हम लॉडिपीन है. Okay, even you can select beta blockers for some cases of patients. They are not considered very, you can say that beta blocker is also related with intrauterine growth restriction, but even you can think of beta blocker as the third line of drugs. कौन सी medicine बिल्कुल नहीं देनी pregnancy में? Antihypertensive. उससे कॉमन एंटी हाइपरटेंसिव क्या होती है जो आप नहीं देंगे प्रेगनेंसी में? ओके, डायूरेटिक्स नहीं देना है, यस, और क्या नहीं देना, और भी सोचे ना, एसी इनहिबिटर्स नहीं देने, ठीक है, कैप्टोप्रिल है या एसिनोप्रिल्स हैं, द एसी इनहिबिटर्स, यू अवॉइड एसी इनहिबिटर्स इन प्रेगनेंसी बिकॉज दे आर दे कैन कॉज पेटेंट डक्टस आर्टरियोसिस ऑफ, तो आपने वो बिल्कुल नहीं देना, एसी इनहिबिटर्स आर कॉन्ट्राइंडिकेटेड इन प्रेगनेंसी. So if the patient is having proteinuria, then you have to quantify कितना proteinuria आ रहा है, you have to exclude, HELP syndrome तो नहीं बन रहा, ठीक है, जैसे इसलिए जैसे एल्डोस्टेरॉन एंटागोनिस्ट भी नहीं देने, कि आपके जो ये बनता है ना फीटल सर्कुलेशन होती है, इसमें आपका एंजियोटेंसिन टू कन्वर्टर वो देंगे आप इनहिबिटर्स, तो देयर विल बी पेटेंट डक्टस आर्टरियोसिस, तो बेबी विल हैव a cyanotic heart disease. तो अगर पेशेंट को प्री क्लैम्सिया है तो यस यू विल क्वांटिफाई द प्रोटीनयूरिया, हेल्प सिंड्रोम को एक्सक्लूड करें, और पेशेंट की मॉनिटरिंग कर सकते हैं आप. इफ द पेशेंट इज up till 34 35 weeks or so, you try to prolong the pregnancy up till 36 37 weeks. लेकिन अगर पेशेंट की मदर के डिटोरिएट हो रहे हैं लिवर फंक्शन टेस्ट या यूरिन RFTs, तो देन यू विल टर्मिनेट द प्रेगनेंसी, ठीक है. और इसमें एक चीज जो आपको याद रखनी होती है, जो ये ऊपर भी मैंने बनाया हुआ है, it is when you are doing a triage, you must have an idea. Triage is that is you are performing a risk categorization, कि किस पेशेंट को पहले देखना है. In triage the mother is always first, you cannot do the sacrifice of mother on the cost of baby. Then her renal function, if her renal function tests are compromising or even health syndrome is developing, you have to terminate the pregnancy irrespective of the gestational age. You will counsel the patient कि माँ के उस पर असर हो रहा है और ये अभी हमें आइडिया नहीं है, और जितना हम बढ़ाएंगे क्योंकि इसकी कॉज प्लेसेंटा में है, जब तक हम वो निकालेंगे नहीं, ये बेबी का पेशेंट का preeclampsia ठीक नहीं होगा, ठीक है. So in severe preeclampsia, even you have to consider termination of pregnancy. So the third comes eclampsia. So yeah, even preeclampsia with severe features. So what would be that severe features? कुछ लिखे भी होंगे शायद. When a patient comes to you with high blood pressure, you have to ask certain questions. क्या क्या पूछते हैं? ये हमने कहा कि ब्रेन में क्या इफेक्ट हो रहा होगा, वो सारे सोचते हैं, उसके हिसाब से हम क्वेश्चन क्या करेंगे पेशेंट से. इंट्राक्रैनियल प्रेशर इंक्रीज हो तो क्या होता है पेशेंट को, सिम्टम क्या आएगी? यस, ओके, क्या सिम्टम क्या होगी भाई? कंफ्यूज से पहले क्या होगा? वॉमिटिंग. So if a patient of preeclampsia is complaining that she is having vomiting, उसके बाद ऑप्टिक डिस्क एडिमा, हमने कहा ब्लरिंग ऑफ विजन, हेडेक होगी ना रेज ICP से, तो हेडेक, vomiting, blurring of vision, और इवन राइट एपिगेस्ट्रिक पेन दैट इज शोइंग ये हेल्प डेवलप करने वाला है. ये स्वीयर फीचर्स है, इस पेशेंट को किसी भी वक्त फिट पड़ सकता है. तो आपने उसकी हिस्ट्री में ये 4-5 क्वेश्चंस करने हैं: हेडेक, ब्लरिंग ऑफ विजन, वॉमिटिंग, राइट हाइपोगैस्ट्रिक पेन. और अगर पेशेंट कंप्लेन कर रहा है तो देन यू हैव टू लुक ऑन एग्जामिनेशन, यू हैव टू परफॉर्म. क्या करना है एग्जामिनेशन पे, क्या टेस्ट देखेंगे जिससे अंदाजा होगा कि इस पेशेंट को फिट पड़ सकता है. इरिटेबिलिटी होती है जब सेरिब्रल, तो क्या चीजें इंक्रीज होगी पेशेंट को, क्या फिट पड़ने के लिए से पहले का क्या साइन आएगा? एनी आइडिया? सोचें. न्यूरोलॉजिकल एग्जामिनेशन में क्या क्या चेक करते हो? फोटोफोबिया, यस, और तो यू विल लुक फॉर रिफ्लेक्सेस, ठीक है. द रिफ्लेक्सेस विद बी ब्रिस्क, ब्रेन की इरिटेबिलिटी है, the reflexes would be brisk, so that it will give you a confirmation that this patient is going to have fit within no time. So उन सब पेशेंट्स में आप देखें इन पेशेंट केयर दैट यू हैव टू एडमिट दैट पेशेंट, उसको बड़ा क्लियरली बताना होता है कि आपको एडमिट करने की जरूरत है. गिव देम मैग्नीशियम सल्फेट. तो एनी आइडिया मैग्नीशियम सल्फेट क्या मेडिसिन? So magnesium sulfate is a drug for prophylaxis of hypertension. Sorry, eclampsia. प्रोफिलेक्सिस करता है मैग्नीशियम सल्फेट, न्यूरोमस्कुलर जंक्शन पे काम करेगा और आपकी ये ब्लॉकेट करेगा नर्व ट्रांसमिशन का, सो दैट देयर वुड बी नो फिट द पेशेंट. So this is the prophylaxis of eclampsia. तो अगर आपको लगता है कि एक पेशेंट में प्रीक्लैम्सिया भी है प्लस वार्निंग साइंस भी हैं प्लस रिफ्लेक्सेस भी ब्रिस्क हैं, तो उसके मैनेजमेंट में आपने ब्लड प्रेशर भी कंट्रोल करना है, आपने फिट्स का प्रोफिलेक्सिस भी देना है. ठीक है. एंड अर्ली डिलीवरी, वंस द पेशेंट इज स्टेबलाइज्ड, जो मदर स्टेबल हो जाएगी उसके बाद वी विल प्लान फॉर डिलीवरी. ओके, लेट मी सी द चैट. Yes, opposite, not sodium. It will not block the sodium. It will act as an opposite and to calcium. कैल्शियम के रिफ्लक्स से आपकी कॉन्ट्रैक्शन आती है ना, तो आप वो न्यूरोमस्कुलर जंक्शन पे ब्लॉकेट कर रहे हैं, ऐसा आपकी न्यूरोमस्कुलर ट्रांसमिशन ब्लॉक हो रही है. तो इट विल बी डूइंग अ वर्क ऑपोजिट टू कैल्शियम. ओके, तो ये सारी ड्रग्स हम पहले भी कर चुके हैं. इसमें से आपको डिफरेंट क्या नजर आ रही है ड्रग? क्या ड्रग डिफरेंट है जो अभी तक हमने डिस्कस नहीं की? हाइड्रोलाजीन. ठीक है. तो हाइड्रोलाजीन के का इट्स बेसिकली vasodilator. Yes, very nice. It's a vasodilator, so it will cause fall in blood pressure. So hydralazine is available as an injectable. So if the patient comes to you with a high blood pressure and you want to control the blood pressure, for example, 160 over 110 or so, you will go for a bolus of hydralazine and you will lower the blood pressure. In that scenario, if the patient blood pressure is more than 160 over 110 millimeter of mercury, you cannot give them these oral antihypertensives. Labetalol, basically calcium channel. This is beta blocker. Nifedipine is calcium channel blocker. You cannot give the oral drugs. You have to go for an IV drugs, and that is hydralazine. Labetalol भी आती है IV. It depends आपको उस वक्त available है hospital में कि नहीं. Hydralazine is more popular and more you can say कि ज़्यादा use होती है. ठीक है. Okay. Okay. Comment on this picture. ये क्या शो कर रही है पिक्चर्स? These are the severity or the spectrum of disease. जब दस हाई ब्लड प्रेशर, ये बस पिक्चर ध्यान में रखें ताकि आपको याद रहे कि यूरिन में प्रोटीन्स आ रही हैं, तो देन इट विल बी प्रीक्लैम्सिया. प्रीक्लैम्सिया के पेशेंट में हेडेक है, ब्लरिंग है, फोटोफोबिया है, हेड राइट एपिगेस्ट्रिक पेन, एंड देन दिस इज साइंस ऑफ स्फीयर प्रीक्लैम्सिया. और फिट पड़ना शुरू हो गया तो दैट इज इक्लैम्सिया. सो फॉर सो गुड. Yes or no? Okay, thank you. Thank you. Okay. So आपके पास जो हम कॉमन जैसे वाइवा में क्वेश्चन करते हैं कि आपने यू आर एग्जामिनिंग अ पेशेंट, she was the case of pregnancy induced hypertension, and while you were examining the patient started having a tonic clonic fit. So क्या करेंगे आप? सबसे पहले क्या करते हैं अगर एक पेशेंट को फिट पड़े? तो उसमें लिखा हुआ है कि आप साइंस में ग्रैंड मॉल सीजर, तो यू ऑल मस्ट बी फेमिलियर विद, जब आपके पास एक जनरलाइज्ड टोनिक क्लॉनिक फिट होता है तो वो उसमें आता है. और इवन दीज पेशेंट इक्लैम्सिया के पेशेंट हम सिर्फ प्रेगनेंसी में नहीं देखते, पोस्ट पार्टम पीरियड्स में भी पेशेंट को फिट पड़ सकता है. ठीक है. सो द फर्स्ट लिखा हुआ है, द फर्स्ट स्टेप वुड बी एबीसी. एबीसी में सबसे पहले क्या है? एयरवे. तो आपने सबसे पहले जो है इफ यू एवर सा पेशेंट, और हो सकता है आपको कभी कुछ पब्लिक प्लेस पे भी नजर आ जाए पेशेंट जिसको फिट पड़ रहा है, so first thing which you will do is that remove all the sharp object from the site of the patient and try to keep the patient's face on the side and secure the airway with that जो एयरवे आते हैं उसके वो डालते हैं मुंह में माउथ गैग के साथ आपका एयरवे सिक्योर होगा एंड यू वांट टू प्रिवेंट द टंग बाइट ऑल्सो उसके बाद आप क्या करेंगे कि यू विल सिक्योर ट्राई टू सिक्योर द आईवी लाइन एंड जो एक फिट पड़ रहा है पेशेंट को उस वो मैग्नीशियम सल्फेट से नहीं अबॉर्ट होगा मैग्नीशियम सल्फेट इज यू कैन से दिस ये आपके पास प्रोफिलैक्सिस है प्रोफिलैक्सिस का क्या मतलब होगा आप ये लगा देंगे तो इसके बाद फिट नहीं पड़ेगा वो जो करंट फिट है टू बॉट दैट यू नीड डायजेपैम डायजेपैम इज बेंजोडाइजेपीन So for the fit that is occurring, you need diazepam और diazepam को देने के से पहले आपको दो चीजों का पता होना चाहिए. One, you dilute the diazepam and give 1 cc water 1 minute. So it's a 1 cc injection, dilute and make 5 cc और वो आप slowly देंगे. Plus these are respiratory depressant. So आपके पास ऑक्सीजन सिलेंडर पड़ा होना चाहिए in any case the patient have respiratory depression. Okay. इसके बाद अब आपकी मैनेजमेंट वो डिपेंड दैट यू हैव टू स्टेबलाइज द मदर ब्लड प्रेशर का कंट्रोल करना है फर्दर फिट्स को कंट्रोल करना है सो मैग्नीशियम सल्फेट लग जाएगा आपके पास और प्लस नंबर 3 इज once the patient is you can say stable तो क्या करेंगे व्हाट इज और मैं जैसे वाइवा में पूछ देती हूँ व्हाट इज द फाइनल ट्रीटमेंट ऑफ इक्लेम्सिया तो व्हाट इज द नो काउंसलिंग काउंसलिंग के बाद क्या करना है फाइनल ट्रीटमेंट ऑफ इक्लेम्सिया इज क्या है प्लान डिलीवरी ठीक है तो द मेन थिंग इज वंस द पेशेंट हैज फिट आप स्टेबलाइज करें मदर की जान पहले है बेबी से ब्लड प्रेशर कंट्रोल करें प्रोफिलैक्सिस दें फर्दर फिट्स के लिए एंड देन प्लान डिलीवरी और डिलीवर कर दें बेबी जब तक आप डिलीवरी नहीं यस काउंसलिंग करेंगे पेशेंट को अबाउट द डिलीवरी आप जब तक प्लेसेंटा नहीं निकालेंगे तो पेशेंट को दोबारा दोबारा फिट पड़ते रहेंगे तो एक दफा फिट आपका ये नहीं है कि आप पेशेंट को फिट्स पड़ रहे हैं और आप ये इंतजार कर रहे हैं कि नहीं कोई बात नहीं अभी बेबी छोटा है हम और निकाल सकते हैं टाइम यू हैव टू रिमेम्बर दैट for eclampsia and severe preeclampsia, mother is prior to the baby, and you have to save the kidneys of mother. और इवन हाइपरटेंशन हाई ब्लड प्रेशर से पेशेंट को स्ट्रोक का भी रिस्क होता है ओके सो ये सिर्फ एक तुम लोगों की जरा मेमोरी के लिए वो इंफोग्राफिक एक मिनट देखती हूँ देखें जरा So this is magnesium sulfate. It will cause the vasodilatation of endothelial function. It decrease the inflammation and oxidative state, and it will decrease the neuronal excitability. आपने देखा होगा कि अब जो है at times we give the magnesium sulfate to the preterm babies. ठीक है in preterm labor भी लगाते हैं magnesium sulfate for the because it decrease the risk of cerebral palsy of baby. यूनेट की कम करता है वहाँ उसमें सो प्रीटर्म बेबीज में यू गिव मैग्नीशियम सल्फेट टू डिक्रीज द रिस्क ऑफ सेरेब्रल पाल्सी और यहाँ प्रेग्नेंट फीमेल्स में दे रहे हैं तो आइडिया इज टू प्रिवेंट द फर्दर फिट्स ये उसके बाकी मैकेनिज्म है आपसे एक चीज जो और पूछी जाती है इवन वाइवा में ये जो आपको आनी चाहिए मैग्नीशियम सल्फेट इज अ ड्रग दैट हैज अ वेरी नैरो therapeutic index any idea what is a therapeutic index yes delivery okay what is a therapeutic index and what is narrow therapeutic index
मैम narrow therapeutic index basically means कि उसकी जो डोजेज है वो बहुत narrow limits के अंदर दी जा सकती है कि
yes
अगर हम थोड़ी सी ज्यादा कर देंगे तो it will lead to their side effects
toxicity ठीक है सो आपकी जो डिजायर्ड डोज और टॉक्सिसिटी के दरमियान बहुत थोड़ा सा डिफरेंस है so magnesium sulfate is one of those drugs So we have to be very vigilant कि आप जब इसको दे रहे हैं पेशेंट को टॉक्सिसिटी ना हो. Ideally, you need, और आपकी बुक में भी लिखा होगा कि you need the magnesium sulfate levels. The problem with us in this scenario is कि वो ज़रा महंगा होता है. आप बार बार पेशेंट के magnesium sulfate levels नहीं करा सकते. So you have to manage the monitor the magnesium sulfate clinically. So clinical signs ये हैं कि magnesium toxicity will cause respiratory depression. It will cause kidney oliguria, and it will cause the absent reflexes. ये होता है ना न्यूरोमस्कुलर जंक्शन पे एक्ट कर रहा है. So हम ये करते हैं कि you have given the dose of magnesium sulfate. So before the next dose of magnesium sulfate, we will look for 3 signs. Number 1, the respiratory rate should be more than 14. Number 2, the urine output should be more than 30 ml per hour. And number 3, the this ankle reflex must be present. Ankle reflex देखना आसान होता है. You can even check the knee jerk, but for me the ankle jerk check करना जरा easy है. तो ये तीनों होंगे, अगली डोज लगाएं. अगर से ये नहीं है तो what can be the antidote of magnesium? अभी आप सब बोल रहे थे यहाँ भी काम करता है वहां भी काम करता है. What can be the antidote of magnesium? Yes, it's limited range. Yes, calcium. So you should, whenever you are prescribing magnesium sulfate, you should have a calcium gluconate available to be used as an antidote if required. ठीक है. और कब तक magnesium sulfate देंगे? 24 hours after the last fit. से पेशेंट को सुबह 9 बजे फिट हुआ, आपने पेशेंट स्टेबलाइज कर लिया, रात 9 बजे आपने उसको डिलीवर भी कर दिया. Even then, for the next morning 9 a.m. you have to continue the prophylaxis of. Okay, so in patients का जैसे हमने कहा postpartum में भी हो सकता है. So this is again an infographic just emphasize few things that you may give a magnesium sulfate for the prophylaxis of next fit, antihypertensive, fetal monitoring, and then delivery of the baby. तो ये आपकी 4 मेन वो हैं point for the management of it. Okay, so अब आप लोगों का test. So 26 years old primary gravida from a rural village presented 32 weeks of gestation for routine antenatal checkup. She is complaining of mild headache and her blood pressure is 145 or 95 millimeter of mercury. So what can be your likely diagnosis? क्या होगा? कैसे पता चलेगा हमें कि इसको क्या है पेशेंट? How can you differentiate between कि ये gestational hypertension है और preeclampsia? Yes, proteinuria. Okay. How will you differentiate that this is a pregnancy-induced hypertension and not a pre-existing hypertension? वो कैसे पता चलता है? proteinuria से नहीं. Yes, over 20 weeks से वो कहती है मेरे पास तो कोई रिकॉर्ड ही नहीं है. फिर any lab test? एक हमने प्रेगनेंसी इंड्यूस्ड हाइपरटेंशन की इन्वेस्टिगेशन छोड़ी हुई थी. लैब टेस्ट हुई. So you can check serum uric acid. Uric acid is a compound that is actively secreted in the glomerular filtrates. Actively means that you need energy to excrete uric acid from your body. So the patients of proteinuria, as we have already discussed, that they will have a glomerular endotheliosis. These patients cannot secrete uric acid from the body. So the serum uric acid level would be more in the patients of pregnancy-induced hypertension as compared to pre-existing hypertension. And we usually use a cutoff value of more than 5.2 or 6 even. A level of 7 needs delivery. In any case, G. Why the blood pressure control is necessary? It's not the gout. The patient, it's a temporary. Once the patient deliver, it will automatically, as the glomerular endotheliosis settles, it will settle. Gout is actually, you can say that in gout there is excessive production or breakdown of proteins, uh, purine compounds, and that is not excreted from the body. Then this is the simply uric acid that was supposed to be excreted from the body as a part of active transport, but in pregnancy, because of endometriosis, that is not occurring. Okay, so let's move to the next scenario. तो ये हलीमा के पास पहुंची है, 30 years old, multi-gravida. So multi-gravida means she has previous kids. 175 or 115 millimeter of mercury blood pressure. Urine dipstick show proteinuria of +3. That would be that must be more than at least 1 gram, 1000 gram जी से ज्यादा, 1 gram से ज्यादा proteinuria होगा. Severe headache, blurred vision. Okay. So likely diagnosis, it would be eclampsia. Eclampsia कब कहेंगे? If the patient has fits. अभी fit नहीं है इसको, तो इसका diagnosis क्या होगा? Would be a severe preeclampsia with, or you can say imminent eclampsia. बस अब इसको fit पड़ने वाला है, ठीक है? So what is the first line drug to prevent the further seizures in eclampsia? That would be magnesium sulfate. ठीक है? और वो फिट जो उसको पड़ रहा है, that would be aborted by diazepam. But investigation should be ordered in this scenario. क्या क्या कराएंगे टेस्ट आपको? Yes. लेकिन इसके क्या टेस्ट होंगे? So she is a candidate whose blood group and plus blood complete plus platelet, urine complete examination, और अगर प्रोटीन यूरिया आ रहा है तो 24 आवर्स यूरिन प्रोटीन्स कराएं, क्लॉटिंग प्रोफाइल कराएं, LFTs, RFTs. ये वो टिपिकल केस है जिसके आपके सारे टेस्ट आपके इस दूसरे के भी खैर होने चाहिए थे, लेकिन इसके तो लास्ट में आपने कराने. और सो इफ यू हैव प्लान, अगर उसका वो है तो आपको डिलीवरी फिर उसके. ओके, आई गेस मैंने आपको बोर नहीं किया. So high blood pressure in pregnancy should be considered dangerous because it can proceed further. आपके पास स्पेक्ट्रम है, प्रीक्लैम्सिया, इवन एक्लैम्सिया हो सकता है, ठीक है? और अर्ली डायग्नोसिस इज नेसेसरी. मैं हमेशा ये कहती हूँ कि एज एन क्लिनिक ऑब्स्टेट्रिशियन, इट्स नॉट कि हम कहें कि किसी पेशेंट को प्रेगनेंसी इंड्यूस्ड हाइपरटेंशन ना हो. हमारा रोल ये है कि अगर किसी पेशेंट को प्रेगनेंसी इंड्यूस्ड हाइपरटेंशन है तो एटलीस्ट वो प्री क्लैम्सिया ना बने. अगर प्री क्लैम्सिया हो गया तो एटलीस्ट क्लैम्सिया ना बने. हम उससे पहले पेशेंट को पिक कर लें और उसको मैनेज कर सकें अकॉर्डिंगली. Even we do see patients of eclampsia even in our setups very often, quite often. अभी जब थोड़ी सी और गर्मी आएगी आपके पास every other patient would be with high blood pressure. So high blood pressure in pregnancy needs pension. And आप में से जो कुछ जैसे अगर बनेंगे फैमिली फिजिशियंस बनेंगे और आपको कभी ऐसे पेशेंट मिलता है तो डू काउंसिल देम कि इनको फौरन आप गायनोकोलॉजिस्ट को दिखाएं, ये टेस्ट कराएं, उसके अकॉर्डिंगली इसको मैनेज किया जा सकता है. ओके, आपने एक पेशेंट डिलीवर करा ली है जिसको प्रीक्लैम्सिया हुआ एट 32 वीक्स. बेबी बॉय है 1.2 kg का. यू हैव डिलीवर्ड द बेबी एंड द पेशेंट प्रेजेंट्स इन परपीडियम और बेबी फाइन है. It's okay, nursery से discharge हो गया, सब कुछ ठीक रहा. What will you how will you counsel the patient for the next pregnancy? क्या करें? एक बात तो बताएं, क्या हो सकता है उसको नेक्स्ट प्रेगनेंसी में? क्या होगा? रिकरेंस होगी, एक तो ये एक्सप्लेन करें. Okay, blood pressure control रखे postpartum hemorrhage में. Okay. Can you give any drug in the next pregnancy that can help not in exactly के pregnancy induced hypertension के लिए, but at least patient की presentation को improve कर सकती है? Any drug? Have you ever listened? No. Okay, no. Yes, urine वो तो थी. अब बताएं ड्रग क्या दी जा सकती है? No idea. Can you think of any drug that can be used? कभी सुनो? So you can give basically Luprin, or that is aspirin, है ना? एंटारिकोटिक एस्प्रिन होती है, लुप्रिन की टेबलेट्स. फायदा उनका ये है कि वो जो है बेसिकली पेशेंट की उसको ब्लड को थिन रखेंगे ना, तो वो जो प्लेसेंटल इनसफिशिएंसी है उसके चांसेस कम होते हैं, बेबी का वेट बेहतर रहता है, और द चांसेस ऑफ प्रीक्लैम्सिया इज लोअर. सो यू कैन प्रिस्क्राइब दिस पेशेंट low dose aspirin, 75 mg दे सकते हैं, or even now there are studies that you can increase the dose up to 160 mg. Not 2 to 3 months before delivery. Usually you will continue the aspirin once the patient fetal heart rate is there, and you continue it as till 34 weeks of gestation. 72 hours पहले भी आप बंद करें तो patient can have delivery. के chances नहीं होते bleeding. Okay. So, और कोई question? तो आपकी जैसे अभी 23rd को वो होता है, वर्ल्ड इक्लेम्सिया डे होता है, उससे रिलेटेड यू कैन आप जैसे आपने उसे मानूर ने बताया आप लोगों का विंग है, डू क्रिएट सम अवेयरनेस पेशेंट्स को कि प्रेगनेंसी में जब भी पेशेंट का हाई ब्लड प्रेशर आए या नॉन डिपेंडेंट एडीमा होता है इसमें. ठीक है, नॉन डिपेंडेंट मीन्स द बॉडी पार्ट्स विच आर नॉट डिपेंडेंट. डिपेंडेंट तो ये ना जैसे टांगे लटकाएगी या पेशेंट बैठेगी तो उसको नॉर्मल भी प्रेगनेंसी में एडीमा हो सकता है, लेकिन आपके पास पेशेंट है जो हम बड़ा टिपिकल कहते हैं ना, एडीमा इज द एडीमा ऑफ नोज. सो देयर इज अ टर्म दैट इज कॉल्ड अ ग्रेविड नोज. वो एक टिपिकल पेशेंट का फूला हुआ नाक होता है, ये पेशेंट कहेंगे कि रिंग्स टाइट हो गई हैं, हमें वो नहीं आ रही. तो इवन यू हैव टू बी वेरी केयरफुल फॉर दैट टाइप ऑफ एडीमा टू, एंड यू that can be one a sign of preeclampsia. पेशेंट्स को ब्लड प्रेशर उस तरह से मॉनिटर नहीं किया होता. So the message is basically in whatever scenario or whatever you can say what identity you are giving care to the patient, you should know the problem that are prevailing in your society. And the number one problem is um, we are very lucky and you can say very privileged that we are sitting like this and we are discussing something. In our setups, at times the women they do not have access to the healthcare, and you can say that it's only the pregnancy that they will see the doctor, and their blood pressure would be checked and all that, and we many of the things that we discover during that antenatal care. So we have to be very vigilant, and we have to be very careful for every patient, so that कि वो आपके पास जब आ गई है ना, at least आपसे कोई चीज मिस ना. तो अगर आपके पास पेशेंट है उसका ब्लड प्रेशर ज्यादा है, तो दिस इज समथिंग दैट मस्ट बी कंसीडर्ड एज अ वार्निंग. आपके पास पेशेंट प्रेगनेंसी में हेडेक, वॉमिटिंग, ब्लरिंग जब भी कहे तो इट शुड बी कंसीडर्ड विद कॉशन. और इट मे बी आप मॉनिटर करें ना निकले प्रेगनेंसी इंड्यूस्ड हाइपरटेंशन, बट यू नीड अ मॉनिटरिंग इन टर्म्स के एक दफा बिठा लें, आधे पौने घंटे बाद दोबारा ब्लड प्रेशर चेक कर लें पेशेंट का, और बाकी साइंस देख. Okay, so any questions? So no questions, so then Abdul Ghani, we can conclude the session. We can have a group photo if you want to switch on your camera.
Yes, yes, we are to have the group photo. Sami Baloch, you are asked for photo to have. screenshot.
यस यस मैम हमें एक ग्रुप फोटो चाहिए सो एवरीवन अगर आप लोग अपनी कैमरास ऑन कर लें.
So will you say this cheese और वैसे ही ले लोगी?
बस मैं ले लेती हूँ सिंस बाकी लोग खोल नहीं रहे अपना कैमरा.
Yes, ले लें जो ओपन करना चाहते हैं they will open, otherwise you have to have.
थैंक यू एवरीवन.
ओके, थैंक यू सो मच गाइस. हम लोग एक एक अवेयरनेस का बड़ा रेगुलरली करते हैं एज अ पार्ट ऑफ फैकल्टी डेवलपमेंट. सो मैं मेरे पास मानूर का नंबर मैं उनके साथ शेयर कर दिया करूंगी. और वेबिनार्स होते हैं यूजुअली, होते तो खैर मॉर्निंग के टाइम है, बट इफ यू कैन स्पेयर टाइम यू कैन ज्वाइन अस. फॉर एग्जांपल अभी जो हम करेंगे वो मेंटल हेल्थ पर है. पोस्टमार्टम पीरियड में जो डिप्रेशन होता है, एंजाइटी होती है, यू कैन ज्वाइन अस. और मुझे तो खैर मजा आया. आई डोंट नो व्हाट अबाउट यू, लेकिन काफी मजा आया. गुड लक.
Thank you so much, ma'am. Thank you so much for such a wonderful and interactive session. And we wish to have some more webinars with you as well. And thank you
ओके,
to the
श्योर
all the
श्योर इंशाल्लाह.
interactive. Thanks to all the participants as well who actively engaged this session. Thank you all.